session now.
This meeting is now being recorded.
Hello everyone, this is Ashley Klein from Prevent Connect, and I want to welcome you to our web conference today, Authentically Engaging Communities to Prevent Sexual and Domestic Violence. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. Today we'll be exploring how to engage communities authentically to prevent sexual and domestic violence through community-driven practices. Our objectives include discussing the value of engaging community members and in having diverse strategies for that engagement. We'll also be sharing examples of efforts that reflect the community engagement process, and we'll be sharing tools and resources that can support and sustain community engagement in our work. So with that, I want to introduce our two wonderful co-hosts for today, Lisa Fujie-Parks and Casey Castaldi, our partners from Prevention Institute. Lisa and Casey, thank you for starting us off in this conversation today. How are you?
I'm doing great, Ashley. So good to connect with you. Hello, everyone. This is Lisa. I'm really excited for today's conversation. Thank you, Ashley, for setting the tone of the web conference. We're very interactive. We like this to be a conversation rather than a presentation. So there's going to be a lot of back and forth between us today, including between Casey and I. Casey, who has been a really big part of this series, is going to be playing a lead role in facilitating today's conference.
Hi, everyone. This is Casey. Like Lisa said, I've been involved with Prevent Connect for a while, so I'm happy to be here today and facilitate this conversation.
Yay. So we wanted to start off by hearing from you some more to get a sense of the different kinds of community engagement work that you are already doing. So if you can head to the text chat and let us know, what community engagement strategies are you currently implementing in your community? And if you want to also share how they began, what was the story of the beginning of those efforts? We're going to come back to see what you have shared with us in just a minute, but we'll give you a few minutes to type your responses.
Great, and before we get going, I also wanted to just thank Michi for being here. She's web teching for us, so before we get going. Great, so today, as we said, we're going to be talking about how to authentically engage communities in sexual and domestic violence prevention. And so we all know that community engagement is a huge piece of prevention work, especially for organizations and folks who are working on the ground. And so even though this web conference is specifically dedicated to exploring what community engagement can look like, it's really been an important theme in almost every web conference we've done this season. And so earlier in the summer, we had a web conference focused specifically on engaging young people. But even beyond that, community engagement has really come up consistently this season for all of our guests and for all of you in the audience. And so it's shown up through participatory community mapping, community surveys, town hall meetings, and a lot of different ways. And so we've really seen that our guests throughout the season have been deeply invested in listening to what communities have to say and using that to find the best path forward. And so just before we get started, I also wanted to sort of say that PI is an intermediary organization. We partner with a lot of health departments and local coalitions. And so while we might not work directly with community members, we really learned a lot through those partnerships regarding what community engagement can look like. And so one of those examples, you can go to the next slide. Yes, is through our Making Connections initiative, which is funded through the Movember Foundation. And so Making Connections works with 16 sites throughout the country on improving mental health for men and boys of color, veterans, and active duty military personnel. And so a lot of these sites, we're in the process of working with them, and they've been great examples of what authentic community engagement can look like in prevention work. And so one example we have is a site in Connecticut that's working with veterans specifically, and they've really taught us about, really strengthening relationships within the community and creating safe spaces that tap into the cultural and traditional roots of those communities. That's really been a strong message there. And similarly in San Diego, which is a site working with young men from East Africa, has really shown us about taking a strengths-based approach to community engagement and prevention, and looking at culturally competent ways to engage with people to really sustain the engagement. So that's just sort of a brief introduction of some of the community engagement that we've seen in our work. But with that, I want to sort of head back over to Lisa and Ashley so they can let us know what folks in the audience have been doing in their communities.
Sure. Well, this is Ashley. I've been seeing a lot of folks talking about connecting with other community organizations, whether that's through different councils or task forces, folks working with campus communities, whether that's K through 12 or college, and even engaging the community as bystanders in their work.
Yep, and I see different programs that involve community engagement mentioned. Some people are talking about one-time events that they might have put on. So definitely a lot of community engagement work happening.
That's great. I'm glad to hear that folks are doing great work out there. So with that, I think we're going to get started and talk with our first guest, Olivia. Olivia, are you there?
I am.
Hi, Olivia. So we're excited to hear about your work. I know that you have a relatively new initiative, and so I'll just give a brief introduction. Olivia is a graduate of Brown University with a master's degree in public health and is a project coordinator for the Newport Health Equity Zone. Having lived in, let me pronounce this, Lilongwe, Chicago, Philadelphia, and now Newport, so Olivia loves to travel and experience new places. She's interested in understanding how one's social environment influences their health, and when she's not working, she really loves culinary adventures that Newport and neighboring cities has to offer. So welcome, Olivia. We're happy to have you here.
Thank you, and good job on the pronunciation.
Okay, great. I'm glad I got that right. So we can start out by, if you wouldn't mind giving the audience just a brief overview of what your project focuses on. We know we've highlighted some of the Women's Resource Center's work on previous Prevent Connects, but we know that the health equity work you're doing is relatively new. So if you can just describe the community you work with and the project you're working on, that would be great.
Sure. So let me just go back one slide. There we go. So the project is a place-based response to health disparities, and we started with a needs assessment. And as we all know, DV is a public health concern. So prior to starting the Health Equity Zone, the agency that I work for, the Women's Resource Center, had funding from the CDC, which really pushed us to look at social determinants of health as a prevention strategy for domestic violence. So it was very much in keeping with our mission to look at health disparities. And although the stereotype of Newport is that it's a very wealthy place with mansions near the water and beautiful, I think it's important to highlight that nearly a quarter of the children in Newport, so under the age of 18, are living in poverty. So there's deep economic, social, and physical barriers that are dividing the city. So the HEZ project, the Health Equity Zone, it's two neighborhoods that are made up of two contiguous census tracts. And although they're right next to each other, the two neighborhoods are very different. So one of the neighborhoods has a commercial real estate corridor that has a lot of mom and pop shops, restaurants, bars, thrift stores, and it's more diverse, both in terms of the types of stores and whether you have homeowners or renters. And the other neighborhood has a block of low-income housing, and it also has commercial real estate, but the real estate is more concentrated in an area, and you have more big box stores, so your Walmarts, your TJ Maxx's, Payless as examples. The population of both communities are a mix, so you have blue-collar workers, you have people that are on assistance, you have students, young professionals. And I think what sets our Health Equity Zone apart from some of the others in the state is that we're the only one being led by a domestic violence agency, and we are very committed to community engagement and communal decision-making processes.
That's great, and at Prevention Institute, we really love it when people are starting to form those linkages between the built environment and health equity and multiple forms of violence. So it's great to hear that you all have started thinking about that a little bit. And And so, Olivia, I know you mentioned that your project started with a community assessment. So I was wondering if you could tell us a little bit more about what assessment activities you conducted and what really was the result of those, and then also sort of what you learned about the priorities of your community through those activities.
Sure. So from the beginning, like I said, we made a decision to really prioritize community voice at every step of the project. So we brought on 12 residents who we have been calling resident consultants to really help guide the process. Now our structure is there's 6 main working groups, which are transportation, arts and culture, open space, physical and emotional health, education, innovation, economic opportunity, and food access. So you can see we're really taking a broad look at all of the determinants that predict people's health outcomes, and at least 2 residents were a part of those 6 working groups. So each of the working groups got to decide the questions that they wanted to ask and the way that they wanted to ask them and of whom they wanted to ask. So the residents really played a role in designing the assessment tools and the data collection. So 4 of the working groups did a combined survey and focus group methodology across the lifespan. The arts and culture group had an interactive survey that went around town and collected responses with stickers. And the Education, Innovation, Economic Opportunity group decided to collect 20 storytelling narratives because they were really adamant about not swaying people's responses. We then built in several feedback loops, and one that I'm going to share today is after we collected all of that data, we put together something called a creativity lab where we just visually represented our data back out to the community, and that's what that photo is of. And residents got the response to add to the data, respond to the data, tell us we got something wrong, help propose solutions. It was extremely interactive. Go to the next slide. Okay, so some of our findings, I'll share the cross-cutting findings. And by cross-cutting, I mean they came up in more than one of the working groups, one of the 6 working groups that I shared. So one is transportation. So the lack of safe, active transportation routes and frequent, widespread, just limited bus service was reducing access to things such as food, healthcare, jobs, education, physical activity. It's a real barrier for residents living in the health equity zone. Another is low social cohesion. So there is a perceived lack of community-based things to do, particularly for kids and teenagers, and it's inhibiting social cohesion. So residents across the lifespan acknowledge that it's a problem, and they would like to see more opportunities for building relations with their neighbors in their community.
That's really great, and it's kind of interesting. So I'm wondering, so did sexual or domestic violence come up at all as a priority issue for the community? Because it seems like, definitely transportation, social cohesion. I think you also mentioned, we have some sort of other findings not directly tied to DV. So I'm wondering if it actually came up when you asked community members.
Yeah, it's a good question. So it didn't come up directly, and for us, that's okay, right? As a backbone agency, I think for the project, we understand that social determinants of health will contribute to the reduction of domestic violence rates over time. So we have to really have faith and be willing to completely agree and back that research and allow our residents to lead the process. So that being said, if domestic violence didn't come up directly, but it did come up more indirectly. So some examples of that is that there was a desire to know neighbors, so social cohesion. There was a desire for more employment and educational opportunities, which increases financial freedom and self-efficacy. There was also a desire to move around the island more safely and easily, so more transportation options. And all of these things are connected to one's broad overall health outcomes and have the potential to reduce rates of domestic violence.
That's great. I'm glad you all are making those connections. Just for sort of context, what are the rates of DV in the community? I know that it didn't come up as an issue, but I'm just wondering what sort of DV looks like where you all are.
Yeah, so it's difficult to share specific rates because for us that often, it's hard to calculate and often doesn't paint a full picture, but instead I think I'll share what we most commonly see are simple assaults, disorderly cases, and violation of no contact orders. But I think what's more important is that rates of DV in the health equity zone are higher than some of the neighboring communities.
Really interesting. So as you mentioned that that in sort of the health equity zone world, you're the lead organization that's DV focused. And so as an organization that's committed to addressing DV, I'm wondering what you sort of make of those like seemingly contradictory statements and what your organization's response has been.
Yeah, so sorry, let me just make sure I'm on the right slide. That's okay. I'm just going to roll with it. So DV doesn't live in a silo, so there are reasons why it happens. And I think what we are looking at are factors that impact unhealthy relationships. So if you make a neighborhood healthier and increase social cohesion and access to resources, DV will decrease. So through doing this work, we're creating space for DV issues to come up in a more organic way in which people feel connected and safe. So this slide here shows we did a walking contest, and it was our way. It was something the residents told us that they wanted, and through that, we really empower the residents to take control of their own lives and their own health outcomes. And doing this work, I think, has also allowed our agency to connect with people that we normally wouldn't have. So we're really listeners, right? So let's stick on this slide. Sorry about that. But we're listeners looking to work with the community as opposed to presenting ourselves as service providers. So we're empowering residents to take control. And we hear all the time that the HEZ project is different, right? We're actually listening to what they want and we're making it happen. And research has demonstrated that empowering communities and connected communities have lower rates of domestic violence. So we're taking the empowerment model that we use with victims and applying it on a larger scale. And if the community said to me, yes, let's talk about gender norms, or I want to talk about a healthy relationship, we absolutely would. But by letting them take the lead, we're empowering them to hear about what they want to hear about and engage in conversations that they're ready to engage in.
That's great. And sorry for the confusion with the slides, but I'm really glad to sort of hear about the origins of your project and how sort of community engagement has really sort of allowed you or allowed community members to name the key issues for them instead of trying to sort of, make it all about DV if that's not really what they want, while still addressing it through a lot of the shared risk factors that are there. And so I hear a lot sort of what you've mentioned about increasing social cohesion and access to resources like transportation and other services. And so what it sort of sounds like is that a lot of this work is also sort of related to increasing collective efficacy within your community. And we've discussed this before, I think, on our last web conference about how while increasing social cohesion is really important and is sort of social isolation is a risk factor for multiple forms of violence, by itself, increasing social cohesion alone won't reduce the risk for DV. But sort of on the other hand, if you increase social cohesion and you improve collective efficacy, it does, there are studies that show that there is an associated rates of lower domestic violence. And so I'm wondering, so in addition to creating healthier community environments, how has this focus on improving social cohesion and collective efficacy had an impact on DV survivors?
Yeah, so as prevention staff, I think DV for many of our quote-unquote clients looks very different because they either, one, aren't victims, or they are already victims, but they don't identify themselves as victims, so they're not really seeking help, or they are victims, or they aren't victims, but they have a high likelihood of becoming victims given the situation which that they are living. So there are clients who feel more comfortable coming through our doors now that we've done this work, so they're able to seek counselors, or they have a greater understanding of what domestic violence even is. And there are relationships that we're able to build with victims in the community and as community stakeholders that support our work in a different way. And I think it's also important to mention that there are things that we're able to do and supports that we're able to give community members that, say, our counselors or direct service folks aren't able to do because our funding streams are very different. So the leeway in which we're given or what we're able to pay for or the support that we're able to provide is very different.
Yeah, that's really interesting. And I can see how those sort of relationships would really help. Before we move forward, I want to throw it back to Lisa because I see that there's sort of been a lot happening in the text chat. I want to see if she has some things to pull out, maybe questions for you to answer.
Yeah, great. So this is really interesting, and I want to hear more of where you're going, Olivia, with how the work that you're doing is helping to create more support for DV survivors. But there was a question in the text chat about the relationship, to kind of tease out a little bit more how social cohesion is a social determinant related to intimate partner violence and sexual violence, and how social cohesion strategies can prevent sexual and domestic violence. So I'm wondering if we could just pause and circle back to that point for just a minute, and if you could talk a little bit more about your understanding of why addressing the residents' concerns about knowing each other and having relationships with each other and fostering more connections within the community, how exactly does that help to prevent sexual and domestic violence?
Yeah, so I think that's a great question, and it's something that if you look at the literature, the research behind it, there isn't a direct causal link. So it's hard for me to really pinpoint why that relationship even exists, but the research knows that it does exist. So some of the things that we can speculate is, well, if you know your neighbor and you're in a tough situation, you'll be more likely to seek help. Or if you know your neighbors, you'll be more likely to know someone who has resources that they can provide you if you yourself don't have the agency to seek those resources. Or if you know your neighbors, you may be more likely to see something yourself and ask them, hey, are you okay? Or check in with them. So these are just some of the ways in which, in terms of a causal pathway, that what could be the reason why there is that link between the two.
And then just touching on, I think I was really appreciating the way that Casey was teasing out the relationship between social cohesion and collective efficacy. So, and you really talked about the importance of communities having agency and making decisions about their own conditions and future. And can you talk a little bit more about that and why that sense of what you called empowerment or having agency and decision making, how is that related to sexual and domestic violence prevention?
Well, I think it's hard to, I think as an agency we are 100% committed to helping victims, but you can only help them as much as they want to be helped, right? So I think giving residents or potential victims or just community members in general the ability to take control of their own lives allows them the agency to be the help that they need for themselves. And I think so many of us would love to see that. And I think from a sustainability standpoint, it's important as well. And just you're getting more bang for your buck when you are empowering residents to seek help on their own when they need it, seek resources when they need it, and even to identify what they need is a huge step as well that can't be overlooked.
I just want to pull out a little bit of what's happening on the text chat. We have folks who are participating today from Haiti. We have folks participating from I have to scroll back to find other parts of the world that people are participating in, but I'm just really curious about, community cultures, look like for different participants, what this issue around social cohesion, how it might look like in different contexts. There's one person who's chatting about her work with relatively small communities like Asian immigrant groups, and that social cohesion is really critical. And it's a pathway for accessing jobs and informal services like childcare without having to navigate the barriers around language inaccessibility or issues around documentation. So it's really, I think this issue of social connectedness and social cohesion can be really profound in many different ways in different contexts. So I'm appreciating folks text chatting, and just want to also appreciate the way that you are talking about this empowerment model that we apply in working with victims of violence to broader communities, and that the notion of not attempting to have power over a community, but really partnering with the community is so critical for doing prevention work that reflects those values. So thank you for taking the time to tease that out a little bit more.
Absolutely, no problem.
Yeah, and so just kind of coming back, I think this is all really representative of the fact that your work is so deeply rooted in listening to the community and exactly what they want, even if it doesn't match up to what you expect. And I think that's something that we all have dealt with, or like a lot of folks doing direct services have probably dealt with. And I also imagine that there have been some challenges to taking that approach. So I will pose this question both to you, Olivia, and in the text chat. So I'm really curious as to how do you garner authentic and sustainable community buy-in for the work, and sort of what challenges have you run into throughout that process? And so folks can share their own stories in the text chat. And in the meantime, Olivia, I'd love to hear what challenges you've encountered and how you've overcome them.
Yeah, I think it's a great question, and something that we've definitely tried to problem solve here on our own. But I think there's a couple things. So true community involvement has to happen both when you're doing the work, both in and outside of work. So we need to be community members and be a part of the community, not just working for the community, quote unquote. So whether that means saying hi to folks that I run into in the grocery store, and taking 10 minutes out of my Saturday when I'm not officially working just to build that relationship has been really important. And I think transparency, secondly. So letting community members know honestly and being really candid about what I'm able to do and what I'm not able to do, and that's allowed us to really avoid false hope or false premises, which unfortunately often happens from public health work. And lastly, just thinking creatively and pushing the envelope with our funders. So there's things that our funders have wanted us to do that the community hasn't expressed to us as a need, and some we have decided not to do, and some we've really pushed back to the funders and said, hey, that I know you want us to do that, but let's think creatively. Can we do it this way? Can we do it that way? What really is the give and take here? How far can we push the envelopes? I think being willing to do that on behalf of the community is important and has been received very well. And yes, we acknowledge that we do have some power because we're the one with the resources and with the political connections, but that doesn't mean that we should be telling the community what issues to prioritize and how to reach certain solutions. So we really do push back. And I think every major decision that we make as a backbone agency is first vetted through the residents and other community partners that are a part of the project to make sure that we are maintaining a collective approach to everything that we do. Yeah.
That's great. And I think just from the text chat has been moving very quickly, so we'll get to that in a second. But even from what I first saw, as soon as you started speaking, I think a lot of the folks in the text chat were sort of, seconding what you were saying around transparency, about, really becoming active members of the community. So I think that a lot of folks are on the same page. But I will let Lisa and Ashley sort of dive a little bit deeper into that, since I know folks were typing away in the text chat, which is great.
Yeah, Casey, I mean, a lot of people, just like you said, were really echoing Olivia's points and talking about giving the community the space to lead and define the issues and solutions for themselves. And then I think another good point was having our agencies really mirror the community that we're serving and be representative of that.
Mm-hmm. Yeah, some really great questions here, and I'm trying to sort some of them out, but here's a relatively simple one for you, Olivia. Rebecca wants to know, who's the funder on this project? Is it CDC, someone else?
It's the State Department of Health. So what they've done pretty creatively is they've actually taken multiple funding streams from CDC funds and put it together in one large request for proposals that went out over a year ago. So the project, it's money from the State Health Department, but it's money that they have received primarily from CDC.
Great, and I'm just curious because I think it's so cool. You mentioned that you're probably the only domestic violence organization leading a health equity collaborative like this. At least you're the only one that I'm aware of. So what are some of the other collaboratives that are taking place in the state? How many of them?
Yeah, so it would be they're your typical suspects, and when we applied for this project, it was, I think, being part of Delta Focus it put us in a good position to understand social determinants of health and the connection with domestic violence and sexual violence, and to be prepared to do this work. But in terms of the other funded agencies, it's who you would normally expect. So your big cap agencies, Thunder Mist, which is a local provider as well, health provider. You have a school department. So we are really a small fish in a rather large big pond. But I think that allows us to do the work differently. I think there are some just bureaucratic barriers that being a smaller agency we don't have to face the same way as if I worked for a larger clinical system.
Oh, that's interesting. Okay, Olivia, there's a lot of questions related to barriers. Are you ready to take some more?
Oh gosh, maybe. Sure.
Well, this is a conversation, so feel free to answer or throw it back to the participants to ask them to chime in. And you've touched on this, so hopefully it's just a matter of elaborating. But this issue around transparency, so actually let me step back and let me start with the issue around, working to really, the way that this participant has phrased it is giving true power to shape the conversation and define the needs and solutions. And you talked a lot about how you did that in your assessment process, but maybe you can just reiterate some of the specific actions that you took to support community leadership in defining the problems and the solutions, and maybe any other practices or principles you apply to really operate in that way when so often public health programming doesn't operate in that way.
Yeah, I think, well, for us it started from the very beginning. So we had a hunch that we would probably end up doing a survey of some form, but we didn't even go in saying, hey, we're going to do a survey for a needs assessment. We let the community players involved and the residents tell us that that's what they wanted to do, and we let them tell us what questions they wanted to ask. So what we did, we really were that intermediary in terms of, okay, you have questions about transportation now, and this is the general question. So let me help you turn that into something that you would typically see on a survey. So we did the background work of finding other assessment tools and polished written questions that got at the heart or the root of what the residents were telling us that they wanted to know. So they really drove the process from the very beginning. And then we let them get involved in actually collecting the data. So brainstorm with me where you want to go with the survey, right? Whose desk should it sit on, or who should see it? Whose opinion are we making sure that we capture in the survey or in the focus groups? We actually had a resident open up her home, and she hosted one of the focus groups, which I thought was really powerful. I mean, it really gave a different feel to a traditional form of data collection, having it in someone's home. And then the Creativity Lab that I talked about was our way of showing, okay, this is what we heard. Did we get it right? So rather than just writing it up in a polished report, we made sure to build in the time to share it back and get feedback and have the community brainstorm solutions with us and best practices and their proposed next steps. So it's a very lengthy process, but it's time well spent on our end, and that in itself also, just linking it back to the how do you get community buy-in, we've also done it through our process, right? Like by engaging them and giving them decision-making power, they see the results as something that they contributed to. We're not just telling them what the needs are, but they contributed to us unearthing those needs. So there's a different sense of ownership there and buy-in and pride that I don't think we would have had if they weren't involved and invested in the process as well.
So a couple other questions relate to this point that you're making about really taking the time to build relationships and to do things in the way that the community folks want it to happen. And Melissa talked about challenges of lack of staff and low funding. And another participant talked about funders not understanding that relationship building takes time and often needs to come first before the quote-unquote program works. So is that something you encountered, or is that sort of built into this particular funding stream, that they really understand that this kind of partnership work really takes an investment in relationship building?
It's a challenge, I think we all work more hours than we should, but it's hard to really quantify that, and it's also very ad hoc. So even if I would have foresaw how much time relationship building would take, there's inevitably things that come up that you don't anticipate. So, for example, we write blogs, and I had to sit with a resident and honestly just show her how to send an email. That's something I would have never foresaw needing to do, but taking the time to do that was greatly appreciated and really built a lot of self-efficacy for her, and has made her a bigger player, and her ability to contribute to the project has grown because of that. So it's hard to, I think, even if the funding entity understands the time that it takes to do that, it's hard to even know from the onset what that would even look like, I think would be my answer.
That's a really great point. There's a couple more questions if you're willing. Another issue that's come up is around transparency around resource sharing, and my guess is that, and you talked a little bit about this, but that money does come with strings, and that you may not always be able to put resource toward what folks are asking for. So, what are some of the ways that you've handled challenges around decisions about how resources will be used, or limits to the partnership that's just structured into the arrangement?
Yeah, I think, we're just upfront from the very beginning, and we're a collaborative process where we have residents involved, but there's also other agencies in Newport that are being funded to help do this work. And to be quite frank, they are giving a lot of in-kind resources, and we do a lot of collective brain power and resource sharing just because we're all very passionate about this. So I think a concrete example is we don't have vans at our agency, but the Martin Luther King Community Center has vans. So when we're doing events, they have the ability to offer their vans so we can pick people up and get over this transportation barrier that we know exists. So I think sharing resources, and that in my mind also goes back to the collective buy-in of everyone involved, allows for a lot of just in-kind resource sharing and pooling of strengths of everyone at the table.
Okay, great. 2 more questions, Olivia.
Sure.
Really interested in your work. I mean, there are more, but I'm trying to. I can't address every single comment, but another comment was sort of after the assessment phase and the community identifies their needs. How do you, what kinds of programs emerge out of that? Where is this work going? And I think you might have talked a little bit about that. And also in that, related to that, transitioning from the assessment phase to the implementation phase, what kinds of capacity building is needed to continue to support, resident leadership and engagement, and, even potentially after the money ends.
Yeah, so there's a lot of things that we're doing this year, but I think in terms of implementation phase, but to answer both questions, I'll focus on one aspect. We've established 2 wellness hubs in the community. They're both at community centers. And through the wellness hubs, we're going to be offering some evidence-based programming, so diabetes prevention program and chronic disease self-management. These are just 2 nationally recognized evidence-based programs. But one thing that we did was we went back to our funder and said, hey, can we train residents to be the facilitators of these courses? So that's an example of how we have found that middle ground of empowering residents while also still implementing something that the funders are interested in seeing. And there's sustainability there. It's a skill, it's a certificate, it's a training that the residents have the ability to take anywhere. They could go out of Newport and offer the program if they choose to do that. And I think even just being willing to do that has been very important. And what I was also going to say was the diabetes prevention course, because it's evidence-based program, you really cannot change the curriculum at all. But what we've decided to do is to offer cooking classes right after the program, because that's something that came up in the needs assessment, was that residents really they know what to eat, but they don't know necessarily how to cook fresh foods. They don't know how to, things even just like freezing appropriately, or if you're a senior, how do you now cook for one? So we've looked at creative ways to couple the evidence-based program, for example, with something more directly the community told them that they would like to have available. So bridging the 2 together has allowed us to also meet the needs of what's come out of the assessment for us.
Great. And then thank you. And last question. I mean, you're really doing multi-issue work, health equity work, right? And including sexual and domestic violence prevention, including, addressing other community priorities. There was one other comment that said, how do you deal with issues like experiences of racism, historical trauma, issues related to the immigration system, as you are working so in-depth on multiple issues in partnership, in relationship with community? Folks are talking about these issues coming up a lot in their prevention work, and just wondering if that's also the case for you, and in what ways you might address those issues.
Yeah, no, that's a really good question. So last year and this year, we actually did a 2-day racial equity training. So we bring in consultants, basically, to run the training. I don't have confidence in myself to lead a racial equity training. But the training, I think last year we opened it up to everyone that was already part of the collaborative. But this year what we're looking to do is open it up to sort of I hate using this term, but gatekeepers, so whether that's the superintendent of the school department or people high up in the police department or local politicians. So taking that system-level approach also to help disseminate some knowledge around what racial issues are and how it's rooted in our history, and even just the connection of how is that related to domestic violence or public health concerns. I think that making that connection too is really important for our work.
Yeah, it sounds, bringing, it seems like a partnership piece. You're bringing in another partner to support the learning and growth of your community to address these really complex issues. So, Olivia, I just really appreciate your thoughtfulness and the ways in which you're approaching this work in your community and your responsiveness to so many questions.
Absolutely. Thank you.
Yeah, thank you so much. And so, it was really great to hear just about your work and building safe and healthy communities and support of safe relationships and safe community members. So we're glad again that you were able to join us, and I think that now we are going to head west to Michigan to our second guest, Layla. Layla, are you on the line?
Yes, I am.
Great. Okay, so Layla is a program coordinator at Access, which is a nonprofit organization in Dearborn, Michigan, and she serves in her role to prevent intimate partner violence and sexual assault against women and girls since 2013. She's currently studying at Central Michigan University to earn a public health degree in community development. She's a member of the Michigan Coalition to End Domestic and Sexual Violence and the Women of Color Network, and she also serves on the League of Women Voters board in her area. Layla is an avid community activist involved in many community initiatives and serves to create a social change movement around social and cultural gender norms within the Arab and Muslim community in Michigan. So Layla, we're happy to have you.
Great, thank you. Thanks for having me.
So I think that we will do something similar and just have you get us started with a quick description of your organization and the different ways you've gotten your community involved in the work that you are doing in Dearborn to prevent sexual and domestic violence.
Yeah. So let me just get started on the slide. So Access, the Arab Community Center for Economic and Social Services, is a center that has been serving the community for more than 40 years. And actually, we just celebrated our 45th anniversary. Today, Access is the largest Arab American human services nonprofit in the United States. We have 8 locations and more than 100 programs serving in our community. We're located in Dearborn, Michigan, which has the largest concentration of Arab and Muslim Americans in the United States. Because we are the largest Arab American nonprofit, Access created the National Network for Arab American Communities to support the capacity of Arab American nonprofit organizations that focus on the needs and issues impacting their community as well as nationally. One of the programs that is housed in our Community Health and Research Center here in Dearborn falls under our Public Health Department, and that is the Domestic Violence Prevention Program. Because our prevention focuses not only on individual and family change, but community and societal change to prevent intimate partner violence and sexual assault. We're serving our prevention program to shift the culture here to be more gender equitable. And this coincides with the overall organization mission to have a just and equitable society with the full participation of Arab Americans. But we can't do that if we marginalize women and girls in our society. So I'm going to move on to the next slide, which illustrates our coordinated community response team. Our CCRT is made up of a variety of different community leaders and community stakeholders that can impact messaging, practices, procedures, and policy changes. This includes school staff, administrators, city council members, religious leaders, basically those individuals that have a lot of social capital. They can impact our community more than others because of their positions or statuses. And our team, our program team, works with them to provide training, skills, resources, basically whatever they need to create the messaging and practices in order to create gender equity, and then support their implementation through activities and initiatives. But the CCRT creates community leaders too. By recruiting marginalized group members like women, especially women of color, youth, and new immigrants, they have the opportunity to partner with these privileged group members to share their social capital, create messages, and then shift the community to see them at their full potential.
That's great. I mean, it sounds like a really interesting work, especially, 8 centers with over 100 programs is really impressive. And so we're going to go a little bit deeper into what that work looks like with the coordinated community response teams. But before we do, I want to sort of ask a leading question to our audience in the text chat. So we've talked a little bit about the general work that you all have been doing in your communities. But I think what we've seen so far is that each community is really unique and has a different set of needs and desires. And I know we've started to touch on this a little bit, but I'm wondering and I'm curious if any of you have taken any or have any culturally specific strategies or approaches that have emerged out of your community engagement. I know it was mentioned before, but I think we want to explore that a little bit more. And so while you all are writing into the text chat, we're going to sort of ask a similar question to you, Layla, which is that you mentioned that your work focuses on, specifically serving marginalized populations and groups, as well as the very large Arab American population in Dearborn. And so I'm just wondering how your focus on those populations and communities has really shaped the work with the CCRT and any other work that y'all are doing.
Well, first, before I get into the next slide, I just wanted to say that with the culture-specific strategies and working with the community, we've kind of used some of the cultural traditions in our favor because the Arab culture emphasizes on community and kind of like raising a child, a community raising a child, and children are taught to help others and contribute to their communities. And there's value in charity, and being a good Samaritan is strongly emphasized. And that has kind of been helpful in our strategies because we know that the community wants to, has learned to always be involved in all their community issues. So that has been helpful for us. But to your other question, and how has working with the most marginalized populations and working with coordinated community response team, I'm going to go into the next slide. And one of the initiatives that we wanted to implement and our CCRT wanted to implement was messaging around girls' education. We know that there's a significant lack of support around young women's education in our community to an extent. We see a lot of girls that are encouraged to go to high school and complete a high school degree, but there's not a lot of support for girls to complete college or a higher level education. And these are illustrated in the graphs on the slide. You see where high school completion for girls in our school districts are over 90%. But of those graduating high school girls, we have 20% or more not going to college. So we worked and are trying to continue to work with She's the First, which is a student organization at U of M Dearborn, which is pretty local for us. And their mission is to change the attitudes and behaviors around girls' education. So what we wanted to do is we wanted to partner with the high schools and work with administrators and young girls to create accessible avenues for girls to apply to college. This included creating a message of support within the schools, among staff and parents, as well as empowering junior and senior high school girls that they can go to college. And this is something that we plan to continue and to grow this work this coming fall. The next slide is our work with our faith leaders in our communities. We predominantly work with Islamic faith leaders because there's a large percent of Muslims, and really faith leaders hold a lot of social capital in our community. Although there's no such thing as a clergy in Islam, many Muslims use their religious leaders comparable to priests. This goes into religious misunderstandings, but we can get into that later. So people go to the religious leader for advice on large life events, and it's the faith leaders that perform the religious ceremonies to go along with events like marriage and divorce. One way we've been able to appeal to our local faith leaders is by using our motto of healthy relationships, peaceful families, and faith communities. These are three very basic ideals that religious leaders strive to create, while it also falls under our message of gender equity. It's just a matter of making religious leaders see that connection. When we are able to make that connection, then we ask that the religious leaders and religious institutions make some serious structural changes that promote gender equity. Some of those issues that we have seen, for example, is when our DV intervention program work with clients that tell us they have a hard time being granted a divorce without permissions from their husband. And this is promoted with the religious leader. So we are working with religious leaders to fight back against that type of messaging and develop a consensus around divorce, especially when a woman's right has been clearly violated. We are also working with them to support and encourage them to use gender equitable messaging in their sermons and to change policies of women's prayer spaces, as well as giving space for women to have a voice within the religious community. An example is when we worked with a religious institution that was connected with a private school that was having issues of unhealthy relationships among their congregants. And we wanted the religious institution to refer to professional marriage counselors because religious leaders that were providing some kind of counseling aren't actually certified, and they were doing more damage than good. So what ended up happening was that the school was able to hire marriage counselors and refer congregants from the religious institution to avoid any harmful outcomes.
That's really great, and I think I know a couple folks were interested in sort of, approaching the faith sector and faith leaders. So I'm glad you touched on that a little bit. It sounds like really great work. And so I want to, before folks get tired from typing, just head back over to the text chat and see if Ashley and Lisa have pulled out any questions for you or any just interesting points that folks are making.
Sure. Thanks, Casey. It looks like folks had a lot of good strategies providing services and programs in multiple language or with interpretation, having campaigns and materials that really represent the community and what the community looks like. And I think Rebecca made a good point to not rely on prevention in a box, but to tailor efforts to community needs. Lisa, what did you see?
Yeah, I think that's a really great point. And I think there are, it's a range of what folks are talking about in terms of their responding to the question about, I think it was culturally specific approaches. Some folks are, talking about just having, basic things like outreach services, interpretation services. Some are talking about partnering with a culturally rooted organization, and then some folks are really talking about work that's really by and for a specific community. So Fatima talked earlier about LGBTQ folks working on prevention issues within LGBTQ communities, and so it's really kind of, folks working within their own communities. So this question of how are you creating an approach isn't really the question, because it's sort of built into the folks being already in relationship with each other. And then Bonnie also talked about doing some work that's specific to the Christian faith, and so folks again working kind of by and for folks within a specific community experience. And I'm wondering if you can kind of touch on this question of, to what extent, is this notion of work by and for the community important? And I'm just hearing from your work that it's probably pretty important and just kind of speaks to the need for prevention resources to not be, to be shared and distributed among a wide range of organizations, some that are sort of public health based and some that are really much more community based and culturally rooted, and just wondering if you could speak to that.
Can you frame it in a question for me?
I know, it's getting more like a ramble than a question. So how, I guess, how important is it that the work that you're doing be by and for the community? And, could the work that you're doing be done by an organization that's not from the community, but, hiring people to partner with the faith leaders, so for example?
Oh, and I think this, because if I look at how this work has been traditionally done in our community, it was very much, our prevention staff going out into the schools, into the community, providing prevention resources, and really a lot of the work was coming from our community-based agency. And although we could make individual changes and we could make family changes, or we could refer victims to our intervention program and things like that, we weren't really seeing the structural changes that needed to happen to really prevent intimate partner violence and sexual assault in our community. And because this is a very close-knit community, and there are the real change makers in our community are like our faith leaders, our community leaders, our school staff, and those people, and mothers, especially mothers in our community, have a huge impact. They just need the resources to elevate their social capital. And so we realized that if we were really going to make any changes, this really had to be a community shift, and it could no longer just be our community-based agency doing the prevention work. So it's very essential that we have our community doing the work alongside with us.
Great, thank you. Apologies that the comment and question were a bit confusing. There's another very specific question from Tracy, who is asking if you could talk about how the people representing marginalized group members are demonstrating their increased social capital.
So one way that our marginalized group members are demonstrating their increased social capital is by working or partnering with our privileged group members, and kind of sharing, the privileged group members get to share their social capital with our marginalized group members. And that could be them sharing contact information. That could be them getting in touch with certain community leaders or certain community stakeholders to elevate that connection for marginalized group members. But also, when we have marginalized group members part of the CCRT, we're providing them a voice and a stage to shift the norms in our community that gives them a more equitable status. Because like I said, our marginalized group members are women of color, our youth and immigrants who have traditionally been marginalized in our community.
Thank you. And one additional question, if that's okay. This question comes from S. Ganbarpour. Would like to know, and this is kind of a tough one, but what do you do when cultural views and norms embedded in the community conflict with gender equity? So the example is, what if faith leaders are willing to condemn domestic violence, but not willing to talk about sexual violence that occurs within marriages?
And I think that I touch more on that as we get farther along in the slides. But this is coming back to our connection of, healthy relationships, peaceful families, and safe communities. And for our faith leaders to condemn domestic violence, they have to condemn sexual violence that also happens in marriages. And we make them, we provide them with the resources, with the knowledge, with the skills. I mean, we get pretty persistent. And this is not to say that our faith leaders in our community are at this spot where they are condemning domestic violence, but we have been able to move some of our faith leaders to that point. But it's been an ongoing battle, and I will get more into that as we get into the slides. Yeah.
That's a good segue, and I think we're going to go ahead and move forward to sort of this topic. So I think what you're saying and what I know we all have experienced in one way or another is that with any sort of big shift towards changing norms, it's an uphill battle, or it can be. And so just curious about the pushback or resistance that you've experienced within your community and how you've overcome that.
So in the past, this program had gotten the reputation that we wanted all women to get divorces, and we didn't value families or relationships, and we got a really bad rap, and community leaders, mostly faith leaders, didn't want to work with us. And it was really hard to get buy-in. And some of the barriers, as you can see from the slide, was that domestic violence was seen as a family issue, and there was cultural stigmas around being public with family abuse. So giving statistics on DV to our stakeholders really didn't do anything. It's not so much that they didn't care, but because domestic violence is considered a private issue, community leaders didn't understand their role and didn't want to get involved. So there was also the problem for us doing the prevention work was that widespread misunderstanding of religious practices versus cultural practices. But we're able to succeed in our work because we do use a public health lens to make that connection that domestic violence and sexual violence are community problems. That when these things happen, it doesn't just affect the individuals or families, but has a ripple effect into the community and society. And giving our community leaders a solution and a way to change that was important to gain buy-in. So we used our CCRT, our Coordinated Community Response Team, and our personal and professional contacts to recruit stakeholders and partners, and collaborated with other organizations that have been doing this work around culturally specific communities and domestic violence, like Karama and the Peaceful Families Project. And as we get into our next slide, I think it's important in our work when working with religious communities or culturally specific communities, and then in our case it's both, that we know the distinctions, especially if those practices or traditions have negative outcomes for a group of people. A lot of our gender equity issues do not come from religion. They're actually cultural, but people confuse cultural norms with religious teachings. For example, traditionally, shame and honor are linked to a woman's reputation, and this is used as a way to regulate women's behavior versus the religious belief and teaching that is against hate and injustice, and that women have the right to education and the opportunity to have a certain standard of living. But negative cultural beliefs are enforced by the misuse of religious teachings. And another example is that both culturally and religiously there's a high value on marriage. So we have seen this use of using religious teachings that illustrate, the high value of marriage and for one to have patience. And this is done to avoid the shame of a failed marriage, even if it's an abusive relationship. Another part that we have to understand is that people's interpretations of religious teachings are highly influenced by their patriarchal values and traditions stemming from those male-dominated societies in which they originated. The stereotypes about Muslims and even people within the religion believe that these oppressive and violent traditions are religious teachings because of the lack of education. So the problem that we've encountered was that some of the gender equitable messages we created were viewed as like religiously incorrect because I'm not a religious scholar. So when we worked with our stakeholders in the community, we prepped them to highlight the differences between religiously rooted practices versus negative cultural beliefs. And this isn't unique to our faith, but it can occur in all or other faith communities.
Yeah, thank you for sharing that. And I think it's really interesting to hear sort of how you've sort of addressed that issue, and I'm sure and folks seem to be really appreciating all you have to say. So thank you for that. And so a couple last questions. I'm just curious about what you see as some of the key successes to your work, and like if there are any key principles or values to the approaches that you take to engaging faith leaders and community members that really allow you to have this sort of dialogue and a chance to change such deeply held values and practices.
Yeah, so we have been using the public health model as our approach to recruit community members to prevent intimate partner violence and sexual assault. When we say we want healthy relationships and peaceful families and safe communities, we can't accomplish that if not every sector that make up a society don't do anything to create that. So when you ask about engaging religious leaders want people to have healthy relationships, and they don't want families torn apart, and we just reiterate that with our messaging. With a public health mission, we wanted an outer level. You have to have an outer level change in implementation of gender equitable messaging. When we do that, we are increasing protective factors and decreasing the risk factors that happen in intimate partner violent relationships, or that lead someone to have an intimate partner violent relationship. So with the public health model, we don't talk specifically about domestic violence and what that does, but we talk more about like when girls don't have access to education, this is what it leads to. And negative social factors are created when you don't provide boys and girls with the same or equitable opportunities and the methods to support that equity. You see all kinds of those risk factors take place.
Yeah, that's great. I think that sort of what I have been hearing from both you and Olivia is just the importance of really taking a look at the larger community and societal sort of environment and how to make the places where people are living and interacting and working, make them safe places so that relationships can be healthy and people can be safe and communities can be safe. So thank you for that.
Mm-hmm.
So we're getting sort of close to the end of our web conference, but before we leave, I want to bring Olivia back and address the two of you with just sort of thinking more generally about the community engagement work that you're doing. I would just love if you could share some sort of key tenets and recommendations that you have for authentically engaging communities that could be applied in various communities so that our audience members can take home and sort of think about in the context of their own unique communities. So Layla, we'll start with you, but any sort of advice that you have to share with folks?
I think I have.
Yeah, it should be the next slide.
Yeah. Okay, so one of the things as that has helped me is that you really have to understand your community. You have to understand like the good, the bad, the ugly, everything. And you want to engage. One way that you can engage in your community, to have your community engage with you is to engage in your community through volunteerism. My work just doesn't stop, once I walk out of the office. I am involved in many different community initiatives and activities that don't specifically go along with the work that I do, but I know that it makes an impact, especially if it's just other community members seeing me out in the community doing other things. Another one is partnering with your youth. They really are your change makers, and they're really not afraid to push the cultural norms. They're really not afraid to talk about things that you yourself might not necessarily like to talk about. So really, they're the ones. If you really want to get into the stuff, like the sticky stuff that you're not sure how it's going to go over, get your youth involved, because youth can have a strong collective voice if you give them the opportunity. Another thing is reach out to everyone. We've reached out to our local driving schools. We've reached out to our local businesses, and we've reached out to businesses that sell, Islamic clothing and things like that. Just reach out to as many people, even if you don't think that they might not have enough social capital to make changes. You want them a part of your community response team or your task force. And another thing that I keep having to remind myself is social change does not happen overnight, and it might be 10 years after doing this work that I might see any difference in my community. But I know that in the long run, it's better for the individuals in my community and the community as a whole. Another thing, last kind of tip, is to get involved in other social issues, because there is intersectionality between domestic violence and sexual assault and other social problems that are happening in your community.
That's great. Thank you for that. Olivia, would you like to add your thoughts?
Sure. So I just kind of narrowed it down to two that really stuck out to me, and one is authentically engaging the community, at least for the work that we have done, means letting the community tell you how they want to be engaged, so being open to their responses. There's an element of choice there that can't be overlooked, and I think that circles back to the question about buy-in and investment in the process. And secondly, just incidents of sexual and domestic violence do not live in a silo, so by improving people's lives more broadly, you can mitigate factors that are linked to sexual and domestic violence.
That's great. I also want to pose a question to both of you that just came up in the text chat that I think is really important, which is about self-care, and if you would feel comfortable sharing anything that you do with the audience.
Yeah, I was literally in the response of typing something, but it's a good question. I find for me getting away quite literally, so just getting out of town, I think the more people that you start to know and being invested in doing this work, when I'm in town, it's hard not to be roped into things, so I often take trips just out of state to just be in a different mental space.
And this is when I saw that question before you asked us, and I was thinking about it, and my problem is that I'm very invested in the work that I'm doing, because I live in this community. I am a woman in this community. I'm raising 3 daughters in this community, and so I almost don't feel like I know that I do sometimes have burnout, only because the extensive reporting that we have to do. But really talking about it and doing the activities around implementing gender equity in my community, I don't see that as work. But I guess if I had to say what like my one self-care would be, is just probably spending time with my kids. So
I think that's a great one.
yeah.
All right, so thank you both for sharing. I know that was sort of a personal question, but we are going to move on really quickly before we end to some resources that folks can check out if they're interested. At PI, we included a few that could be of interest. There's a few reports that we published. One is, again, just our Making Connections initiative, and the other one is another report we published a few years ago on sort of the role of community culture. And then if you could, and there's a slide with the fancy covers of those, and so Michi just sent those out. And then Layla, I know you had a few resources you wanted to share with folks.
So there's a couple of resources that have helped me, specifically working with faith-based communities, but also specifically working between the cultural distinctions and the religious ones. And that has been kind of partnering with Karama, which is located in DC, but they've come out to help us on different projects and different initiatives, as well as using resources from the Faith Trust Institute. The CDC is our funders. We are part of the Delta Focus project. They have a lot of great resources on using a public health model to prevent intimate partner violence. And I also included our website, our agency website. There's some information about our domestic violence prevention program on there. And also the Asian and Pacific Islander Institute on Domestic Violence has some really, really great resources on working with culturally specific communities.
That's great. Thanks so much for sharing. And all of these will be available for folks on the Prevent Connect website, along with the slides from today and the recording of our web conference. So that, let's turn over to Lisa. Lisa and Ashley, do you have any last thoughts?
Well, I just wanted to thank everyone for joining us today for this great discussion. Thank you, Casey and Lisa. Thank you, Layla and Olivia. And we hope that you'll join us for our next session, where we take a look back in the years since the Connecting the Dots report was released to see how research has been put into practice to prevent sexual and domestic violence.
Great, and this is Lisa, and I just want to give my thanks as well to our guests today. Thank you so much for sharing your incredible work that you're doing in your communities. I have such deep respect and admiration for the work that you're doing, so thank you for doing it. Thank you for sharing it with us. And thank you to the Prevent Connect community for also engaging in conversation and sharing your own experiences and resources. And thank you to the PI team and especially to Casey for facilitating today.
Yeah, thank you, everyone.
Thank you all. This concludes our web conference for today. Take care.
Thank you. Thank you.